So we will have our next speaker, also coming from Mumbai, Professor Purna Kurkure from Tata Memorial Hospital. She is also the past president of SIOP Asia, and she had also been doing a lot of work on the late effects in pediatric oncology in India. So we will listen to her talk on this important topic as well.
Good morning, and I bring you greetings from Mumbai. As the topic of discussion is late effects, and it was common to me and Dr. Melissa, what I have done is, after her overview of the late effects and what to expect, I'm just going to give you the organizational part as to how one can get organized, which is very, very essential for developing long-term care and cancer survivorship program, which are lacking in our part of the world. Now, in cancer control continuum, we all know, we are very familiar with this slide, that it starts with prevention, early detection, diagnosis, and good treatment, which leads to survivorship. And therefore, more and more focus is now being given to this part of this continuum of care. Now, definition of survivorship, as it is given by National Coalition for Cancer Survivorship and NCI Office of Cancer Survivorship, is an individual is considered a cancer survivor from the time of cancer diagnosis through the balance of his or her life. But for practical purpose, as we all know, we consider disease-free survival for at least 2 years, or after cessation of therapy, or 5 years from diagnosis, when we start looking at the long-term and the late effects. And this concept of from diagnosis leads to this seasons of survival, which is living with cancer, which is at diagnosis and through treatment, living through cancer when you stop, when you complete the treatment, and living beyond cancer, which is a long-term survivorship, which leads to an individual who is new normal. He is normal, but he is new normal with his past cancer experience. And just a small brief history that it's a very recent phenomena, and it has emerged or started in United States, where in 1985, survivor and physician Fitzmullan identified survivorship as a distinct phase of the cancer journey. And then the National Cancer Survivor that foundation was formed, and survivorship gained the terminology, or it became an entity from art to science, definitive science. And in 1995, imperative for quality cancer care, and first time the survivor's perspective was used in defining quality of care. And in 1996, NCI started this Office of Cancer Survivorship, and then on, there is no looking back in this aspect, at least in United States and all the Western European countries. But it is still a new phenomena for developing countries, because we are still in the phase of improving our survival first to be concerned about survivorship. According to the American Cancer Society, there are now more than 13.7 million cancer survivors in the United States, and that number is expected to grow to nearly 18 million by 2022. And the mission of survivorship program, which has been defined by the NCCS, is the mission is to address the outcome of cancer and its therapy, and improve cancer survivors' health and quality of life through integrated programs in patient care, research, prevention, and education. So it is a holistic approach of not only diagnosing and treating, but what happens beyond treatment, which leads to what quality of life also matters. And thus the NCI's survivorship priorities which have been laid out are long-term or late effects of cancer and its treatment, which we have all heard from Dr. Hudson. Then monitoring outcomes, in the light of this morbidity that a survivor carries with himself or herself, role of behavioral and socio-cultural factors in patient outcomes, understanding genetic risk and treatment, and training researchers and disseminating research findings. So if you look at critically, the development of survivorship program can be divided into three clear phases. Phase 1 is the infrastructural development. Phase 2 would be professional education and research in this field. And phase 3 will be public awareness and advocacy program, where the survivors will speak for themselves and regulate the authorities to work in their favor and be in a commanding position. So, starting from the medical-centric approach, it will get converted into a patient-centric or a survivor-centric approach. Why do we need a survivorship care plan? First and foremost, to summarize and communicate what transpired during cancer treatment, to describe known and potential late effects of cancer treatment with expected time course, which we just heard, and to communicate to the survivor and other healthcare providers what has been done and what needs to be done in the future. And to promote, all these attempts are to promote a healthy lifestyle to prevent recurrence and reduce the risk of other comorbid conditions. Now, if you look at broadly, the components of the survivorship program or a survivorship are two. One is a medical and the other one is a psychosocial, which I have labeled as societal. So medical is exemplified by the late effect follow-up clinic, and societal is through the survivor support group who work for other parts, psychosocial and advocacy part. And this is, I will just give you a small example of what we achieved at Tata Memorial Hospital through the medical late effect clinic, which was basically inspiration from Dr. Hudson and what we saw at St. Jude Children's Research Hospital. Basically, the medical component is a long-term follow-up program, and it should include at least a single physician who is interested in late effects, a nurse or nurse practitioner coordinator, a dedicated time and place, at least 2 follow-up clinics a month or more if it is a high-volume center, comprehensive care and screening for late effects based on the survivor's treatment, referral to appropriate specialist and wellness education. So there are several models of care. One is a shared care model where a specialist works collaboratively with the primary care providers. The second one is a nurse-led model in which nurses take responsibility for cancer-related follow-up care with oversight from physician. And the third, which is, I think, is the most easy to implement in a pediatric oncology setup, and I think we should begin from there, is a specialized survivorship clinic in which multidisciplinary care is offered at one side, and then with the gradual increase in experience and sensitization and awareness of other colleagues, you can move on to other two models which are more cost effective. As I said, taking inspiration from St. Jude Children's Hospital, we started this after completion of therapy or ACT clinic way back in 1991. At that time, perhaps I was alone in the journey, but now I have many colleagues and we have a dedicated late effect study group in our Indian Pediatric Oncology study group who is going to look at it in a more focused way. And the objective of this clinic, as we all know, is to monitor growth, development and sexual maturation of survivors, to monitor late effects of therapy, to address psychosocial problems of the survivors, rehabilitation for useful productive adulthood, and provide feedback for future protocol modification. Organization again is a multidisciplinary team approach. I will not go, and the patients, the survivors are looked at and periodically depending on their risk, and they are given the summary of treatment and recommended plan for follow-up. There is internal and external physician as well as the patient with information which are related to cancer treatment the patient received, late effects of treatment manifested or potentially expected over a period of time, preventive care recommendations, psychosocial concern, and recommended referral. And we had from 91 to February, this is an opportunistic capturing of the survivors and does not reflect all the survivors that we had at the institution. And as you can see, there is a male preponderance, and it's a mature data of almost 9 years of median follow-up since entry into ACT clinic. And what I want to point out, more than half of them have now become adolescent and young adult. And with that comes more responsibility of handling this AYA population, who is very mobile and more vulnerable and more likely to stop the follow-up. And that is the challenges that you face with these AYA survivors when they graduate, and they have these questions that how they identify risk and problems, who will assess their cancer-related concern, how do they find a specialist who will take their concerns and symptoms seriously, will they get insurance cover, will there be any discrimination in job and marital prospects, and what resources are available to them. They don't want to be called handicapped, but they are special new normal, and what resources can be provided to them. And this group of survivors were given an opportunity in SIOP 2007 by interacting with ICUPU, as you can see here. And then they themselves came up with this idea of forming a support group, which they have labeled or they have questioned as UGAM, which means to rise. And they call themselves Victors of Childhood Cancer Survivors. And it was started on 7 June 2009 with a vision to ensure that every childhood cancer survivor find his or her way to celebrate life and to facilitate their life's journey on correct path. Through self-empowerment, helping young patients who are undergoing treatment and social awareness. Thus, the ACT clinic, which was started as a medical late effect clinic, has now resulted into a more holistic approach of a survivorship with all its facets. When we look at the Indian scenario, more people are surviving cancer today. There is excellent training of oncologists in curative cancer treatment, but little training in follow-up care of survivors. Survivors can be lost in transition to passive follow-up phase of survivorship. And survivorship issues are not channelized through structured advocacy program. So with this aim, Indian Cancer Society, which is the biggest and the most oldest not-for-profit organization in the country, we have started to develop multidisciplinary survivorship program module and create SOPs to reach out the majority of cancer survivors in country. And this partnership in cancer survivorship optimization is the project which we have launched recently. And the target population is to begin with childhood cancer survivors and survivors of adolescent and young cancers. This is a cartoon from MD Anderson, where you can see there is a difference of almost 28 years from the time they started looking at childhood cancer survivors to others. And perhaps we won't take that long, but the whole idea is to encompass all the survivors into the fold. And the professional education is definitely required to train the oncology care providers in this aspect, that is survivorship. So to conclude, benefit of a survivor care plan, there is a psychosocial distress can be addressed, cancer recurrences can be caught early, preventable conditions may be avoided, and potentially lethal late effects may be averted. Thus, quality of life can be improved. So it's a holistic approach, and therefore survivorship is a challenge which is a fact, because we are still struggling with more improving survival rather than looking at survivorship. Survivors will increase year by year, and the impact of long-term survival are well known and more to learn, and therefore survivor care plan is a must. It's an investment even for the developing country, and we must concentrate on that. And multidisciplinary approach through outpatient care or with the partnership are desirable. Thank you.
Thank you. Thank you, Purna, for sharing the successful program. Actually, it's probably one of the best in Asia.